All right. Hi, everyone. Welcome. We're so glad to see you all today. So my name is Megan Grzybowski, and I am the talent acquisition team lead here at Dana-Farber. On behalf of the talent acquisition team, I would like again to welcome everyone to this fall 2021 Road to Success event. We really value our internal talent here at Dana-Farber, and the purpose of this event is to provide you with access to information about opportunities for growth and advancement that exist within the Institute. We have 5 managers who are presenting today that you will be hearing from who hire for their respective departments, and we're very thankful for their time and participation in this event. At the end of each manager's presentation will be a few minutes for questions, so please hold your questions until the end of each individual presentation. At that point, we will open it up and you may either ask your question live yourself, or you may also use the chat to enter your questions there if that would be more comfortable for you. I'll now turn it over to Candace Burns, who is our Director of Inclusion and Workforce Development.
Hello, everyone. Thank you so much for joining us today. It is great to have you. I want to especially thank our hiring managers who also see the value of really retaining awesome talent that we have here at Dana-Farber. And that's what the goal of this program is to really connect to those of you who might be interested in advancing in their careers or perhaps even changing their career focus. To be able to connect and hear more about the opportunities that exist here. So again, thank you to our hiring managers. So without further ado, I want to also, we invite you to come off camera. I know as a hiring manager, I'm a real person, and so seeing a face and then perhaps seeing them again makes me connect with them even that much more. So again, encourage you to come off camera if you would like. But without further ado, I'll turn it over to our colleague and TA, Thomas.
Thank you, Candace. Thanks, everyone. Thanks all for being here. Our first speaker will be Elaine Ziv, the Business Director for Cell Manipulation Core Facility. And I will hand it over to Elaine to share her slides.
Okay, thank you. Bear with me while I pull them up real quick. I tried to not have too many things open today. All right. So as Thomas said, I am Elaine Ziv. I am the business director for the Cell Manipulation Core Facility, and that is a mouthful of a name. So we refer to ourselves as CMCF. We are a department of approximately 65 individuals with a variety of backgrounds, all working on our mission to produce safe and effective cellular products for both standard therapies such as stem cell transplants and novel clinical research protocols such as CAR-T products. So we support clinical research that uses cellular therapies. We manufacture for the Dana-Farber patients, Brigham and Women's, Children's Hospital, and the Harvard Cancer Care Transplant programs, as well as other institutes across the country doing regenerative and genetically transformed cellular products. At any given time, we support more than 40 active clinical research protocols. And these pictures show our products being administered in the OR here in the top corner. And also some of our kids that we have treated with products that we've manufactured who are looking well and happy. And it's great to see pictures coming in to see that they are continuing to do that way many years later. Our department offers an opportunity to affect and help patient outcomes without actually being on the front lines. So this slide shows how many groups we are. So all of these down here at the bottom are an individual group within our lab, all reporting up to our Senior Administrative Director, Olive. There are 2 main points of entry for the majority of our entry-level roles, right here in this little red rectangle. And through myself and business administration column, we are currently recruiting for a couple of positions. One of those being an evening lab assistant who assists the lab and catches up on equipment cleaning, does some of the sample and product transfer of products that are in our tanks from long-term to short-term storage and vice versa, and helping do work that the lab assistants during the day are unable to get to just due to the busyness of the lab. We also have 2 materials management positions who are responsible for bringing in the supplies for our lab, maintaining the inventory, and making kits of supplies needed for the processes performed in the lab. In our Pascarella tissue bank here under Doreen, this is a blood, cell, and serum repository. We at times have openings for our lab assistant positions. And as Candace said earlier, as director of the workforce development program, Doreen has a lot of workforce development students come through her lab in the summer and throughout the academic year. And this group banks a variety of specimens for a variety of research protocols. So beyond the entry-level positions, we have a variety of career paths, some with current openings. The others in the department are business, IT, data management, biomedical equipment technology, quality assurance, cell processing specialists, and cell therapy testing techs. And we've had many individuals in the past move from the entry-level positions into these roles, from materials management into lab assistants into cell processing techs. We've even had workforce development students who have started and have made their way all the way up to being senior lab processing techs in the lab. So what are we looking for? The attributes are the same for all positions. It doesn't matter what level. I would say the biggest one I'm looking for is attention to detail, as we need to track lot numbers of supplies or numbers on products or patient medical record numbers. The other one worth noting is the first bullet, that this is a way to help patients indirectly. I am somebody who cringes at the sight of blood, but I still wanted to help people. And I have found this as, as the business director, as a role where I'm still helping people as the supplies that I buy and the budget that I oversee. The supplies, are put into the kits that are used to manufacture the products for a product that we all hope will be a cure for a patient. So we'll just go through a couple of the different groups in the department. So the lab assistants perform a variety of procedures, such as processing samples, performing monitoring of particles in our clean room, getting our clean room set up for the day for the techs to come in and process. The bottom picture here shows one of the lab assistants in the Pascarella tissue bank. And again, they support banking of blood, bone marrow, and other tissues for many research protocols. In patients undergoing stem cell transplantation, immune therapies, and cellular therapies. And they utilize specimen inventory databases such as FreezerWorks and CA Tissue to track the de-identified barcoded samples. So materials management, this is how we store all of our supplies because we can't keep anything in boxes due to the cleanliness that we need to upkeep. So it's more than just ordering, receiving, and delivering. They unpack all supplies that come into our lab, obtain certificates to show the sterility of all of the items that we use in our processing. They divide them out by date and receipt, and we keep them in all of these different bins. They perform kitting and use great attention to detail to document lot numbers and expiration dates of supplies on all the process-specific lot sheets that accompany the kit into the lab, because anything that is used in manufacturing needs to be tracked in case there's ever a recall and we need to figure out what has been used in particular manufacturing product and see could it have caused some risk to a patient. Our stem cell processing lab provides processing, cryopreservation, and thawing of products for the stem cell transplant programs. These pictures show our techs dressing up as superheroes to deliver the products to patients at Children's Hospital. And here you can also see the types of PPE that is worn in our clean rooms, not just for processing, but even to enter the door. Our novel cell therapy labs manufacture for cancer and non-cancer related cellular therapies. We manufacture CAR T cells, limbal stem cells, Treg cells for a variety of diseases from leukemia to corneal scarring to ALS and MS, which is a trial we just finished up. So a whole variety of stuff, even things that are beyond the scope of patients at Dana-Farber. Our cell therapy testing lab, CTTL, does all of the product testing for our products. They perform flow cytometry, purity testing, such as sterility, endotoxin, and mycoplasma. And these are some of the bottles going into and being looked at in our sterility, our Bacti alert system, checking on how all those products are. So there's billions of dollars being invested in the future of cellular therapy. Just even looking at Cambridge and Boston, there's new buildings being put up every other week, it seems like, for cellular therapy. Lots of companies want to come and work in Boston. And there's a huge need for individuals with exposure to these areas. So please routinely search for CMCF openings, as there may be one someday that fits what you are hoping for and hoping to do. As we do have a wide variety that doesn't have to be, for the people who just have like a quest for science. As myself with this non-science background, there is a home for lots of people in the CMCF. And this is our very old picture of our department. I think it's 3 or 4 years old now, but you can see we are a good size and we continue to grow based on whatever contracts we are bringing in. That's all I got.
Elaine, thank you very much. We will pause now to see if there are any questions. Feel free to pop those questions in the chat and we will do our best to get those questions answered. And if we don't get your questions answered today, you're invited to attend the office hours that the respective groups will be hosting in the coming days. So we'll pause for questions, and then at 2:15, in about a minute's time, we'll start the next presentation, which will be clinical operations and business analytics.
Sure, my office's hour is Thursday at 1. If anyone wants to jump in, myself and Olive will be there.
Well, I will invite Niran Sorohi to launch his slides onto the chat here, so we can review the slides, and we'll get started with the next presentation. Elaine, thank you very much. Up next, we have clinical operations and business analytics. Speaking now will be Niran Sorohi, the Senior Director.
Hi, everybody. Thanks for inviting me. I'm the Senior Director for Clinical Operations and Business Analytics. You might also hear us referred to as COBA within the Institute. So a little bit about COBA. So COBA sits within Informatics and Analytics, which is a central department within Dana-Farber that reports up to Bill Hahn, the COO. And before I kind of get into the details of what COBA does and what some of the roles are, I think one of the things I wanted to share was, what's our overall mission within the Institute? So within the Institute, we have lots of data being collected in many different parts of the Institute. So our goal in COBA is to really help our internal stakeholders use data in a more strategic way to drive decision-making that they do either on a day-to-day basis or decision-making that they may do in a strategic fashion. So what do I mean by that? Like a day-to-day decision might be, how many schedulers do I need to put, right, to make appointments for patients? That's almost like a tactical day-to-day decision. The strategic decision that the Institute might make is, where do I open up my next satellite location, right? That's not something you decide on daily, but you decide on kind of infrequently. And both of those decisions, data can be used in a manner to kind of make an informed decision. And that's kind of what COBA helps its stakeholders with. A little bit about our team. So we work with a lot of different stakeholders in the Institute, and I'll show that to you. So we have multiple people working with multiple stakeholders in the Institute. And really, if I thought of like, what are sort of the unique value propositions of what we bring to the table? One is, we have a very collaborative and friendly kind of approach to how we do things. That is not just because it's nice to do, but it's also because it's really important to our mission to be able to connect the dots and bring value to our stakeholders. We also have a very team-oriented approach because we might be working with 40 different stakeholders, but the COBA team is really getting to see the big picture in terms of all of the data that comes across in the Institute. So opportunity to learn multiple domains for people who work in COBA. You could be working on HR data one day, and next year you could be working on clinical operations data. The third year you might be working on radiation oncology data, right? So lots of opportunity to learn multiple domains. and apply kind of an analytic skill set and a problem solving skill set to a diverse set of problems, because each of our stakeholders has very different problems they are trying to solve. So it gives our team members an opportunity to not just learn multiple domains, but then also apply their analytic knowledge and mindset to solve problems for many different types of areas. A little bit about like what COBA looks like today. So like I said, we support stakeholders across the institute. Today, we support about 25 stakeholders, and we have sort of broken these up into 4 groups. If you think about it, we primarily, anything other than research in the institute, we support directly in one fashion or the other. And we have broken them up into 4 groups: clinical operations, which is all of our stakeholders and internal clients who are involved with clinical operations, whether that be scheduling or admin directors or nursing ops or pediatric operations, everything like network operations. We have another team that focuses mainly on financial aspects of the research operation. So research administration, they deal with finance, revenue cycle, philanthropy, research admin and finance. We have a team that kind of focuses on clinical stakeholders like quality and patient safety, nursing quality, palliative care, DFCI pathways, the patient reported data program, pharmacy, occupational health, and general EPIC reporting as well. And then finally, kind of a set of stakeholders that kind of qualify more as corporate functions. So HR, supply chain, facilities, strategy, and we even produce reports that are meant really for the executive committee to be able to see kind of a broad picture view of how the health of the institute, if you will, right, on a monthly or quarterly basis. How do we do this? We kind of do this with an extended team of about 31 personnel. Extended because we also work with team members who might not directly be a part of COBA, but are analysts and use data in many different ways, but are actually organizationally within a stakeholder. And we essentially produce at the institute level kind of data assets and analytic services. So just to give you a feel for the scale, for our scale, we have about 320 plus active users today in the institute. So people who have actually accessed our analytic assets in the last 30-day timeframe. We have 50 plus kind of what we call subject area marts in our enterprise data warehouse. And then we also have like 160 plus dashboards in production. So Dana-Farber has centralized on the Tableau analytic platform. So we have dashboards that we produce there that are then accessible in an automated fashion to groups of users that have permissions to do that. So this is kind of what COBA really works on today, with different stakeholders producing these analytic assets in a collaborative fashion with all of these players. I wanted to talk a little bit about one of our, this is kind of our entry level position, and I'll share with you how this sort of grows over time for people who come into this, but we call it an associate business intelligence analyst. So this is typically aligned for folks who are just coming out of school. So just coming out, if you have just finished like an undergrad degree in statistics, computer science, IT, math, public health, or a related field, and you have no work experience working at an employer, it's an ideal role for someone like that. They might have done internships, and we obviously prefer that. And I think that kind of 3 areas where we do require some experience is experience using SQL. So for those of you who don't know what SQL is essentially structured query language. It's a way by which you can manipulate and aggregate data that sits in an enterprise data warehouse. It's a programming language. So experience using SQL is required. I think knowledge and familiarity with business intelligence tools, which there are many of in the marketplace, but we use Tableau at Dana-Farber. And then finally, knowledge and familiarity with general Microsoft Office suite software. So that's kind of more of the hard qualifications, if you will. And then in terms of soft skills, since kind of our primary goal is to work with stakeholders and answer business questions and bring data to bear, really the analytical reasoning and problem solving skills and a curiosity to kind of answer questions and learn different areas quickly is an important piece. So along with that comes kind of interpersonal and communication skills, being able to communicate and interface with many different people in the institute in different departments, understand their problems, and then kind of do the analysis and communicate back the findings and help our stakeholders understand like what to do with this data, right? Kind of brainstorm and collaborate with them and co-create with them is an important skill to have. A little bit about how, people kind of grow within COBA. So this is sort of our career ladder that we use. So somebody coming in as an associate analyst, they're working primarily with a single stakeholder. So you might be working, let's say, with HR or with, or you may be working with palliative care. But you are focused on kind of working with a single stakeholder, learning the domain and the data and their questions. And you are learning multiple tasks on a project. So at this level, you are kind of working under the supervision of like a more senior analyst as part of a project. And then you are creating the setup tasks to create meaningful data. And as you kind of grow in your career as an analyst or a senior analyst, what happens is you start to lead more tasks independently as part of your role. You start to work on multiple stakeholders as part of the scope. And in terms of the deliverables, you move from just producing analyses to actually starting to interface with stakeholders and telling them how to use those analyses to solve the business problems they have. And then at the highest level, at principal analyst and leadership levels, you're also getting into more of people management. So you actually have direct reports and build and grow managers and leaders under you. And then, yeah, so that's all I had. I think, I have an office hour, I think, set up for tomorrow morning. We have set up an office hour. So definitely feel free to ask any questions either now or come talk to me during our office hour. And we do have, the other thing I should say is as of now, we do have multiple associate business and intelligence analyst positions open that you will be able to see if you go to the Dana-Farber Careers website.
Thank you very much. And I do see a question in the chat. And that question reads, do you consider bootcamp graduates that are transitioning from other fields, such as having a BS or MS in a health-related field? This person is currently in a bootcamp for backend, SQL, and DevOps with Python.
Yeah, absolutely. So if you have a BS or a MS and you have done like a data camp, or there are the numerous boot camps out there, LinkedIn Learning, or even if you haven't done a boot camp, if you have just kind of done self-study, typically in our process, we put people through a very basic SQL test in the beginning as part of our hiring process. It's not a test that meant to challenge your SQL skills, but more to establish a baseline. So somebody who's come out of a boot camp or even done self-study will usually easily be able to pass that test. But yes, short answer is yes.
Excellent. Thank you for answering that question. And a thank you from the candidate as well. We still have a couple more minutes for questions before the next presentation starts. So feel free to put those right in the chat.
And the other thing I'll add is I spoke a little bit about COBA, right? So COBA is a team within informatics and analytics. But as people grow, there is also an opportunity to kind of branch out. Informatics and analytics has a similar team that kind of works with researchers and principal investigators and labs in terms of building applications. We also have several horizontal capabilities like data science and computational solutions and strategy and architecture. So there is lots of opportunity to grow even within kind of informatics and analytics within our team and even outside our team.
And your office hours, when is your office hour?
I think my office hours are 9 to 10 tomorrow.
Okay, wonderful. Thank you very much. And what we'll do now is we'll invite the philanthropy team to launch their slides when they're ready to do so.
Thank you, Thomas. Hi, everyone. We're going to be getting started in just a moment. My colleague Sarah is joining as we speak. It's nice to see all of you.
Hello, everyone. I'm just joining the Zoom. Were there any introductions done, or should we start there?
I'll do that now. Thank you, guys.
Okay.
So, yep. So we've now had the clinical operations and business analytics presentation. Next is the philanthropy team. So we have Sarah Shin Lodagiani, the Senior Assistant Director on Administration, and Ali Connor, the Officer on Administration. And here they are now.
Thank you, Thomas. It's so great working with you as always. Hello, everyone. What a great turnout for this event. Ali and I are really thrilled to be here. I see some familiar faces too, which is always fantastic. Ali and I are here to represent the Division of Philanthropy today and to share a brief presentation with you all on our wonderful department, the work that we do, and some of the opportunities that are available on our team. And before we dive into that, just wanted to share that why Ali and I are the ones here sharing about our department. Ali and I really partner on all of the staffing initiatives for philanthropy and work closely with Thomas and other human resources colleagues on recruiting and onboarding and employee experience. So we're really pleased to be here. Ali, anything you'd like to add before I get started?
No, thank you, Sarah. And hi, everyone. As Thomas said, I'm the officer on the administration team. So I work closely with Sarah and Thomas and focus on recruiting for our entry-level to mid-level roles within the division. So we're excited to share a little bit more.
Thank you. We thought we would get started with our presentation just by sharing a bit about the Division of Philanthropy, our who, what, and where, for lack of a better term. So to start, the Division of Philanthropy team at the Institute is a team of 270 staff, including our open positions. And we are all split among 20 different teams. So with a team of almost 300, I often like to say there's something for everyone in our department. It's just a matter of timing for when positions become available. We have teams that focus on finance and reporting. We have teams that focus on events, teams that focus on corporate partnerships, fundraising, donor relations, and we're happy to share more about each of those topics, but there truly is something for everyone in the Division of Philanthropy. And what we all do every single day in philanthropy is really work together to try to achieve Dana-Farber's mission of a world without cancer. So we are trying to raise as much funds as possible by many generous supporters, individuals, families, partners, to hopefully put ourselves out of business at Dana-Farber. We know that will take some time, but that's our goal. And in the last full fiscal year that we had, from October of 2020 to September of 2021, our team raised a record-breaking $402 million for the Institute. That was the first time our team had ever raised over $400 million. And it's something that we're incredibly proud of. And where do we do the work that we do? Well, our physical location is at 10 Brookline Place, just outside of the Longwood Medical area. However, in September, our team really transitioned to what we call dynamic work, and that's a majority remote workforce. So the majority of our 270 person team operates from their home offices on a regular basis. We have some positions that do have an expectation to go in a few days a week or one day a week, and that's typically listed in job descriptions in philanthropy posting. So you can always find that there. And so following this, we wanted to talk a bit more about what our team focuses on before we talk about some of our openings. So our division is led by our Senior Vice President and Chief Philanthropy Officer, Melanie Duval. And when Melanie is talking to our team or to giving presentations externally, she often talks about our priorities as the 3 C's: culture, constituents, and campaigns. The campaign. So what we wanted to share with you all is just a bit more about that in case you haven't had the opportunity to hear about those topics from us. So starting with culture, culture is very important in philanthropy. And one of the most common questions I'll get from candidates or external individuals is, what's one word you would use to describe the team? And that word is collaborative. We are a very collaborative team. We work together every single day, even though that now looks a little bit different since we're all virtual. We're using Zoom and Teams and email in virtual rooms instead of in-person rooms, but we all work together to raise as much funds as possible for the Institute. And not only do we work together with our internal philanthropy teams, we work very collaboratively with all of the departments at the Institute. So we are working with faculty and physicians to understand the work that they're doing and then translate that to donors. We're working with all of you if you are interested in getting involved in our events or volunteering. We work with payroll, we work with finance. It's a very collaborative environment because the core of philanthropy is relationship building. So some other aspects of our culture, dynamic work, which is what I mentioned about our remote work environment, that certainly impacted our culture, as we mentioned. However, we've seen a lot of benefits come from that as well. Being able to zoom in and out of meetings versus go to different buildings. Donors, have shared feedback that it's much more convenient to pick up a phone or join a Zoom room than to travel to certain meeting locations. So there's certainly been benefits to that as well. Another aspect of our culture, which I would be remiss if I didn't mention, is our Inclusion, Diversity, and Equity Council. So this work started focused in this capacity in about 2019. We had an all-staff retreat in philanthropy where we talked about some topics related to inclusion, diversity, and equity. And what came from that was the realization that we really need to focus our efforts here as a team. And so in partnership with Dana-Farber's ID&E team, we had started to put a group together to brainstorm what actions we wanted to take in these spaces and thinking about inclusion, thinking about diversity, and thinking about equity. And in 2020, we put together an Inclusion, Diversity, and Equity Council, which focuses on 3 areas: fostering an inclusive team, engaging diverse supporters, and telling an inclusive story. And members across all of our teams work to move the needle forward in a lot of different areas related to our work in this way. And then lastly, I'll just mention learning and development. We certainly utilize and enjoy the learning and organizational development team at Dana-Farber's resources. And we're also fortunate to have our own internal learning and development program focused on philanthropy specific topics. So every month our staff receive a calendar of opportunities that they can attend during the workday at no cost, focused on philanthropy specifically. Moving into constituents, why this is important is because this is how we do the work that we do, through our donors, through the relationships that our team is building. So you can see here, some of the different types of donors that we have. We also work incredibly closely with volunteers and many partners that contribute their time and resources in kind, and that's essential to the work that we do. So putting those constituents at the forefront of our days, of the work that we do, allows us to raise the funds necessary for the Institute. And lastly, our last C, campaign. I truly hope all of you have heard about our ongoing campaign. It is called the Dana-Farber Campaign, and the tagline is Defy Cancer. The ongoing campaign is an institute-wide effort led by philanthropy, and we have a goal of raising $2 billion for the Institute by 2024. There have been some institute-wide communications about this. The email or the URL linked here is also a great resource. This is our campaign webpage, defycancer.org. But our entire team is focused every day on making sure we can reach that $2 billion fundraising goal for the Institute. And with that, I will turn it over to Ali to talk about some of our openings.
Thank you, Sarah. So we wanted to take a few minutes just to review some of our current opportunities available in philanthropy. And as Sarah mentioned earlier, we have 20+ teams. So there are always opportunities opening up, but these are just a few to highlight. So starting, you'll see the Assistant on Planned Giving. This is an entry-level role for our division. And if you're not familiar with what planned giving is, it's a form of fundraising that focuses on gifts of real estate, trusts, bequests, retirement funds, essentially non-cash gifts that are realized much later on. So this role supports 2 frontline fundraisers on the planned giving team with their donor management and database management responsibilities. So helping to schedule meetings, inputting donor information into our database, which we have a donor database within philanthropy called Clearview, adding any real estate materials, tax information that's important for later on once those gifts are realized. So the team is looking for someone who has strong attention to detail, is a good communicator, both written and verbally, and can manage ongoing projects. So you'll see here that there is no prior philanthropy experience required for this position, and some other of the requirements listed below. Looking at the assistant role on our principal and major gifts team. So again, assistants are generally entry level in our division. And this team, the principal and major gifts team, focuses on working with individual donors who give over $100,000 to Dana-Farber. So our high giving capacity individuals. And this assistant provides also administrative support to 2 frontline fundraisers on the principal major gifts team, helping them to schedule their donor visits, their meetings with faculty members and physicians, helping to draft gift proposals, as well as letters of acknowledgement, thanking our donors when we have received a gift. So again, the managers are looking for a strong writer, someone who is proactive and can ensure that deadlines are always being met. And again, this role does not require prior philanthropy experience. And then the last role you'll see posted here is an executive assistant position on the Office of the Senior Vice President team. So this role supports our Senior Vice President and Chief Philanthropy Officer, Melanie Duval. I hope you've heard her speak at open forums and in various other capacities. So the executive assistant supports Melanie in all of her work and is really a vital person in the operations of philanthropy. So this role manages Melanie's calendar, her schedule, her prospect work, the approval process for all 20 of our teams, and really acts as a liaison for internal and external constituents, drafting correspondence on behalf of the Senior Vice President. So this role really deals with a lot of sensitive and highly confidential information. So the team is looking for someone who is really able to thrive in that fast-paced environment and manage multiple tasks. Philanthropy experience is a plus if you have that or have some working knowledge, but you can see some of the other requirements listed under here as well, but that was just a quick overview. And so we wanted to open it up to questions, either questions about philanthropy or about the positions that we just shared. Sarah and I oversee the searches, so we're able to speak to those and answer any questions that you may have. So you're welcome to post them in the chat box or come off mute.
And we can leave that last slide up for a couple minutes here and wait to see if any questions come in. And thank you very much, Sarah and Ali. This is really wonderful.
Absolutely. So the email that you see here on the slide is our philanthropy inbox that Sarah and I manage. So if we can't get to questions today, please feel free to always reach out through that inbox. We're happy to talk through the internal hiring process or just be a resource.
And remind me of the office hour that you have.
We have our office hours tomorrow morning, Friday morning, sorry, Friday. From 10:30 to 11:30.
Wonderful. Okay. Well, we have a shy group so far, no questions yet. But if anything comes up, I'll shout it out for you both. If you could just stay on for another few minutes. But in the interim, we'll ask that the grant administration, if Candace Hatchie could launch her slides right on cue. Thank you, Candace. So that was the philanthropy team. Thank you, Sarah and Ali. Next, what we will have is the grant administration team. Speaking will be Candace Hatchie, the Department Administrator of Medical Oncology.
Thank you so much for having me. My name is Candace Hatchie. I'm one of the department administrators in medical oncology. Medical oncology is the largest research department in the Institute. Therefore, we're broken up into 5 different divisions. And specifically, I manage the divisions of molecular and cellular oncology, which is all wet lab based, as well as the solid tumors group, which is 12 disease centers. So primarily they're seeing patients with some clinical research mixed in. Research actually makes up 50% of the Institute's revenue on most years. So this is sort of the definition of what research administration is. We're lucky to have a fabulous central office called Grants and Contracts, but at the department level, we have to work really closely with the faculty to help them prepare for their grant applications. And then once they're funded, then we manage the post-award. So we call that pre and post-award. Now, not all departments in the Institute break their grant management specialists, which is called the DGMS for short. They don't break them into two different categories, pre and post, but we do in medical oncology because we feel like it's the best way to completely support our faculty is to know what's going out for applications and then managing them on the back end. So this is how it's spread out between pre and post award. And so we work proactively with the faculty to identify funding opportunities. We help prepare the applications. We submit it to grants and contracts for review. And then once it's funded, we manage it on the back end. Who's working on this project? What kind of supplies are they going to need? And basically, depending on the level of support, some of our faculty have administrative support and some of them do not. So depending on the level of administrative support that they have, sometimes the DGMS has to be a little bit more involved in their day-to-day operations, such as hiring or reconciling a P card or those types of transactions. So it really depends on the faculty member and what kind of support they're receiving. So basically our goal in our office is to really alleviate the administrative burden on the faculty so they can do all the cool things that they do at Dana-Farber, whether it's research, drug discovery, clinical trials, taking care of patients. Our goal is really to take away that administrative burden so they can do what they do so well here at Dana-Farber. These are just some examples of funding sources that we work with that make up a research portfolio. So we work with like a lot of nonprofit foundations, institutional research support. That's if we have a new faculty member coming in, the Institute is going to provide dedicated support for 5 years. After the 5 years, they're expected to be self-sufficient. So it's really important for us to help work with them and sort of be like a financial advisor and look at what their expenses are versus their revenue, because after that 5 years, they really become like a small business and they're responsible for funding their laboratory. NIH is our biggest funder. And there's a lot of rules and regulations that you have to know that comes along with that. We have a lot of grants from the Department of Defense. We work really closely with our donors and philanthropy. Industry-sponsored research, that's managed through our innovations office. So we work really closely with the innovations office. Our solid tumor group, they do a lot of industry clinical trials. And then we also get a lot of endowments and professorships from Harvard. One of the really cool things about the job is that we get to interact with so many different central offices. So this slide just shows all the different teams that we get to work with on a daily basis. And we all work together to support our faculty. And the DGMS really is the spokesperson for the faculty member. So we're working with all of these departments to really represent our faculty. And yeah. Something interesting about research administration is that it's not something you can really go to college for. So I know Emmanuel does have a postgrad program. So most people don't even know what it is until they sort of fall into it. So these are some of the key skills that we look for because people really aren't searching for it necessarily after college, but you have to have an effective communication skills, attention to detail, multitasking, critical thinking, and you have to have some kind of basic financial skills, and you have to be proficient with Excel. If you have all these skills, then you'd probably be a great fit for the grant management specialist position. We also have a wonderful job family. So it starts at DGMS 1 and it goes all the way to manager. So there's 5 levels. The minimum requirements for DGMS 1 is just a high school diploma now, which is fantastic. So there's a lot of opportunity for growth. And what we do is we try to balance the research portfolios based on levels of experience. So somebody new coming in is going to have a very small portfolio with a new faculty member, maybe something that's not super complex. But when you get to become like a DGMS 3 or 4, now you're considered a mentor on the team, a leader. You're going to have a more matrix portfolio with some more complicated funding mechanisms. And then when you're a manager, you're overseeing a small team. So there's a lot of room for growth. When I actually started at Dana-Farber 13 years ago, I started as a DGMS 2, and now I'm a department administrator. So there's really a lot of opportunity for growth in this role. This is what my team looks like currently. We are broken up into 4 small groups. So that allows for a lot of small team interaction, and we try to balance the research by manager. So for example, one team might manage all the research that's done on GI. That way there's a lot of collaboration and you get to know what the faculty is working on. And if someone's on vacation, you can cover, you feel confident and comfortable that you know the people, the players, the funding sources. So the teams typically meet weekly, and then we meet as a big group monthly. But just because we have them by teams doesn't necessarily mean you can't ask someone on another team a question. There's a lot of integration in the group. Certain people have subject matter expertise, so you can go to that person, even though that person's not on your team. We're a really collaborative group. A lot of people on my team have been at Dana-Farber for 10 plus years. So that's great. We also have an operations manager who sort of oversees all the lab operations, and if a piece of equipment breaks or something like that, they help manage the call. And we have an intern, and then we have a CCG business manager, which is one of the centers that we manage. I currently do have 2 open positions. They are posted at senior level, but we are willing to hire someone junior if it's the right fit. So if anyone is interested, my office hours are tomorrow. I think it's 1 to 2, and I'd be happy to discuss the position with you, or if anyone's interested in doing a job shadow, I'm happy to do that as well. So just, yeah, feel free to contact me.
Thank you very much. Thank you for breaking down the different levels of the career ladder there as well. Speaks to the move for growth as part of that group. And your office hours, you said, were tomorrow afternoon?
Tomorrow, yes, 1 to 2.
Excellent. Well, we will pause for questions. None so far in the chat during your presentation, but if any come out, I'll certainly shout them out and send them along to you. In the interim, Alyssa, if you'd like to launch your slides. Thank you very much. And so that was the grants administration group. And up next, we have new patient operations. And speaking, we have Alyssa Patiris, the Director of New Patient Operations and Dana-Farber Direct Connect.
Hi, thank you for having me. As Thomas said, I'm Alyssa Patiris. I'm the Director of New Patient Operations and Dana-Farber Direct Connect. Oh, sorry, there we go. So you see a few pictures of members of our team here, new patient coordinators, record specialists. This is just a small sample of our amazing team. Right now we have 64 new patient coordinators and record specialists and 5 supervisors on the new patient team. And we schedule appointments for adult oncology new patients at Longwood and Chestnut Hill. And our job is really as the initial face of Dana-Farber, the primary point of contact for all new patients. We're really the people that are shepherding patients and families through, this very scary, challenging, confusing time. Some of our patients are calling having been newly diagnosed. Some are later in the stages and are maybe looking for clinical trials. So, you know, having such a wonderful team as the first virtual face, it's all over the phone for the most part, is so important. So we facilitate the triage, clinical triage, appointment scheduling, financial clearance, registration, materials collection, directions, suggestions for restaurants, all of that stuff, everything someone could need before they come in for that first appointment usually goes through our team, or we help plug the patient and family into the right point of contact. So from an overall org structure perspective, here I'm showing my two branches. So on the left is the new patient operations side, and on the right is the Direct Connect. I can talk about Direct Connect if we have enough time, but focusing on the left side, our new patient coordinators and record specialists all begin as level ones. They're, as I mentioned, that main point of contact for families and family representatives, patients, doctors' offices for setting up that first visit. Our requirements are a bachelor's in health administration, strongly preferred, but not required. So high school diploma is the requirement. And a minimum of 1 year healthcare and or customer service experience. From there, over the last, I'd say 5 or so years, we've done a lot of work in building out the job growth opportunities. I actually started off as a new patient coordinator 10 years ago in sarcoma and bone oncology. And I've been in a really fortunate position to work with my boss and HR and other key people within the organization to move from a model where we just had new patient coordinators and record specialists, and that was it, to this tiered structure. So after working as a level 1, you can get promoted into a level 2 new patient coordinator or record specialist. The new patient coordinators really focus on, like I said, the clinical triage, those first conversations, getting the patient scheduled and registered, and the record specialists focus on the materials management. So collecting pathology slides, medical records, imaging, all the pieces of information that our doctors need in order to make that first treatment recommendation and begin treatment, et cetera. So for the level 2, we promote people who have been in the role for a year and show strong leadership skills. They, in this level 2 position, train our new staff within the disease center. And I forgot to mention that our new patient coordinators and record specialists typically work with specific disease centers. So there's the opportunity to really get to know a group inside and out, partner with the clinical team to learn breast oncology or thoracic oncology. So you really become an expert in that area. And that allows you to train new people after you've been in the role for a little while. We also have level 2s working on special projects, helping us create training materials. NPCs and record specialists are really the content experts. They know the patient populations, they know the challenges that they face for that specific diagnosis. And so I and we as a team really value that input. And being promoted to that level 2 gives you the opportunity to be more involved in that because you have some time and expertise under your belt. From there, you have the opportunity to potentially go into one of the supervisor roles. We have 5 supervisors on our team, and each of them manages a group of NPCs and record specialists. 2 years in healthcare customer service experience is required. Management experience is not necessarily required. It's very helpful. And being an NPC or record specialist in the past isn't a requirement. We've had people be really successful coming from external organizations and learning the ins and outs of Dana-Farber. Similarly, we have a level 2 there. Having been in the level 1 supervisor role for a while, and then you have my role as director. So what do we look for the new patient coordinators, record specialists, supervisors? Compassion, great organizational communication, customer service skills. Like I mentioned, you're the face of Dana-Farber for the patient. You're the one that is helping ease this transition, making sure that everything that we need for that first visit, everything the patient needs is there and ready to go. And we're always refining the process. So the ability to implement new concepts quickly, to problem solve in the moment is so important. Everything that we do is for the patients. Every change that we make and problem that we identify is in an effort to make the process easier for our patients. Strong attention to detail, ability to multitask, and great interpersonal and collaboration skills. You're working with so many different people. As I said, patients, family members, external hospitals, and then internally, you're partnering with our social work team, with our records, our HIS team, access management, financial counseling. So you're really the central person working with many, many different departments of the organization. So as you can imagine, I view these roles as extremely important, and think that it's a great position, and have really enjoyed being such a big part of the new patient process for so many years. So thank you. And I have my office hours on Friday from 1 to 2. Would be happy to talk with anybody, but please feel free to ask any questions if you have any.
Thank you very much. And certainly a great legacy of growth. You said you started as a level 1 new patient coordinator yourself, right? 10 years ago?
Yeah, yep.
Excellent. So a great opportunity for all. And thank you very much for sharing those slides and making yourself available for the office hour on Friday afternoon. So we will now move over to the next presentation, which will be done by Human Resources by Regan Casey, our Talent Acquisition Sourcing Specialist, and Kathleen Pena, the Program Manager of Workforce Development.
Thanks, Thomas. I'm going to go ahead and share the presentation on my screen, and then we'll get started.
Good afternoon, everyone. As Thomas said, I'm Kathleen Pena. I am the program manager within Workforce Development, working with adult development initiatives. And we just went through a lot of information. So we acknowledge that it's information overload, but don't worry, we're going to have all of this compact for you. And in the next slide, we're going to review the office hours that a lot of the hiring managers have shared. And now we're going to go over some key takeaways with my colleague, Regan.
Great, thanks for the intro, Kathleen. So as I go to the next slide here, yes, I am the Talent Acquisition Sourcing Specialist, and I know that a lot of information was shared in the last hour or so, but great information about what we have available for next chapters or next steps in your professional and career at Dana-Farber. So with all the positions shared today, and if there's even more for you to do some research on, if you're interested in applying, you can browse our open positions on the internal DFCI careers page. There is plenty of opportunities to promote from within, and DFCI really values that. So the internal careers page is a special portal for internal talent that will help emphasize that candidacy throughout the process for those that you're interested in. If there were opportunities today that you noticed that you may know someone would be a great fit for, good people know good people. So check out our employee referral programs. This is a new initiative starting, and there's more information on our intranet pages to talk about that. But currently, the programs we have going for are clinical research, pharmacy, and imaging. And then if you have an opportunity and want to think about getting further in your education and getting that associate's or bachelor's degree, our workforce development team has a program called College for America, and we'll be sharing their inbox email address to reach out for more information if you're interested in that. It is an opportunity for undergraduate programs only, and it's an opportunity to afford a more affordable education. And then overall, if you do still have remaining questions from today, or just questions in general about your next step or other interests of employment at Dana-Farber, we have a form on the talent acquisition pages called the Internal Talent Network form. It's a smart sheet form where you are able to fill out and get the chance to speak with one of our recruiters about any and all opportunities about your next chapter here at Dana-Farber. And if there are any other questions at this time, I would love to open up the floor for them.
I just want to say that you'll be receiving a survey. We really would appreciate your feedback as we can try to continue to bring programs like this, additional programming like this. Your insights, your feedback, your thoughts are extremely, extremely important and helpful to us. We'll be on the lookout for that within the next week.
Yeah, and with that said, we will be sending out a follow-up email from this event, like I mentioned earlier, that will include the specific links I referred to today on my takeaway slide. The recording of this event will be posted to the intranet sometime next week, and the survey, as Candace mentioned as well. And then just one more plug there for anyone wants to jot down these times for the office hours in the coming days. Again, will also be shared in the email immediately following this event.
And the email following the event will also include Zoom links to all of these office hours for you. So there's no need to reach out to the managers or anything directly. We will make sure that you have those links available to you in the email that you will receive very shortly following this presentation today, so that you can access any of those office hours that you're interested in attending. Great. Well, thank you again, everybody, for coming today. Thank you to all of our presenters. Thank you for everybody who signed up to participate and attend this event. We appreciate all of your time. And again, please be on the lookout for the follow-up email with the links to all of the resources that we discussed today here at the end of the presentation, links to the Zoom invites for the office hours, and the presentation, I'm sorry, and the survey, so that we can get some feedback from you as well about your thoughts on today's presentations and future events that you would like to see us do. Thank you again. Enjoy the rest of your day.